Once you start looking after patients who've got food allergies, it very quickly becomes apparent that there's an enormous overlap with eczema. Most people who have got a food allergy will tell you that during the first year of life they had eczema. What the studies show us is that the more severe that the eczema is and the earlier that their eczema starts, the more likely it is that they will develop food allergies, typically to things such as egg, peanut, tree nuts and sesame. As our understanding has developed, it's now become clear that this isn't just a coincidence, but actually it's a causal association. It turns out that skin barrier dysfunction, which is the leakiness of the skin barrier that you get in eczema, actually predisposes to the development of allergies. And the more leaky that your skin is, the more of a chance there is that the immune system that sits underneath it will see food allergens in the environment during early infancy, typically before the baby started to eat those foods, and develop sensitization to them that then leads to allergy. Eczema is really common. It affects around 20% of UK infants, and the majority of children with eczema don't have any food allergies. In fact, doing blanket screening for food allergies on all children with eczema is really unhelpful. It often throws up lots of positive results that actually don't mean very much, so it doesn't add anything to the care of the child. However, there are certain children where allergy testing is definitely worth giving further consideration. For example, those children who have got more severe eczema, particularly where the eczema has proven difficult to treat, or eczema that started very early, and particularly in children where there appears to have been a reaction to something. So for example, the first time the child was given egg, one of those common food allergies, and there seemed to be some sort of reaction. It's children like that where allergy testing, particularly when it's more focused and has to be accompanied with a detailed clinical history, can be much more useful. For many years there was debate about what the underlying cause of eczema was. Some people believed that it was genetic and others believed that eczema was an allergic disease that was driven by either things in the diet or things in the environment. And then some years ago there was the discovery of the filaggrin gene, which made it much clearer that the underlying problem in eczema is skin barrier dysfunction. It's genetically programmed. But that very much predisposes children who have got that skin barrier dysfunction to get allergies. Those allergies, and in childhood it's typically food allergies, can then contribute to making the eczema worse. And that can happen by a number of different mechanisms. With some children, irritant foods, nothing to do with allergies at all, will cause flares of eczema. So classically things like tomatoes or strawberries will cause redness around the mouth. That's harmless and nothing to worry about. But with other children who do have allergies, either through an immediate IgE-mediated pathway, they can cause reactions, typically with foods such as egg, peanuts, tree nuts, sesame, where there's a very obvious flare of urticaria, angioedema, and associated eczema very quickly after ingestion. But also there can be delayed type reactions, type 4 hypersensitivity, where having foods such as milk or soy in the diet on a regular basis can cause the eczema to be chronically worse. This is harder to diagnose because it relies on a detailed clinical history and we don't have reliable tests to do it. But an exclusion diet can often reveal that there's an underlying problem, followed by reintroduction to confirm that that food does make things worse. It's notoriously difficult to try and work out if particular foods are causing flare-ups. So really it requires a detailed history together with allergy testing where it's appropriate to try to get to the bottom of whether it's necessary to do food exclusions. I'm very aware in my practice that many patients will try and work out exclusions themselves and often not tell their GP, for example, that they're doing these exclusion diets, and this can lead to quite significant nutritional issues. So it's really important to engage patients about their concerns, understand what they're worried about, what foods they're nervous about, what they've actually excluded and how effectively they've done that. So really this all comes together as a complete package of proper eczema care that involves getting the first line measures right, including the emollients, the topical steroids, together with a very open-minded conversation about the possibility of allergy and then exploring that further if it's clinically indicated.